Okay, hypertension means what? Hyper.
High blood pressure, ma'am.
Yes, high blood pressure. Then what happens in high blood pressure, hypertension? Anyone remember? Anyone? It is. This is hypertension. Hypertension occurs when? It occurs when you have high blood pressure. That is ranging from when? From 160 by 90 mm of Hg. Okay, so these things can occur when you have high blood pressure. Understand? And if you have high blood pressure, uh, you can have risk also. Risk like what? You can have heart disease, stroke, and sometimes it leads to death also. If you have high blood pressure. So the causes of high blood pressure or else hypertension or what? It might be because of smoking. Too much smoking can cause hypertension. It might be because of overweight, too much fat, no? Obese, you can say obesity. So because of that also hypertension can occur. It can also occur in when there is lack of physical activity. Lack of physical activity means when you don't do anything. Okay, you just sit, eat, sleep, repeat like that. So it occurs at that time also. Next is too much salt in the diet. Means if you consume too much of salt in your diet, if you put too much of salt in whatever you eat, you can have hypertension. All this it contains in chips and all also contains too much of sodium and too much alcohol consumption. Okay, if you consume too much alcohol also, you can have hypertension. Okay, so I'm just revising it. I've already discussed it in the previous class. And again, it might cause hypertension can also cause because of what? Because of stress. If you have too much stress, you can have hypertension. Okay, it can occur in older age also, aged people. And next is genetics. Genetics means what? If your grandparents were having, if your grandparents were having, then you can have at that time also. And next is what family history. Then same thing only with the genetics. The same thing means if your parents were having maybe grandmother, grandfather, whoever were having, like you can have risks for hypertension and also because of kidney disease. Kidney disease also you can have hypertension. Just now. And after that what? After that because of adrenal. Means after that she can do copy paste. Because of sleep apnea. Sleep apnea means what? Sleep disorder. Because of sleep disorder also you can have hypertension. Okay, is it clear? The causes of hypertension? I guess it's clear. No reply. Okay. Okay, Asang Modi, tell me three causes of hypertension. Three causes of hypertension. Tell me. Hey, yes, Asen, can you hear me? Yes.
Yes, ma'am.
Tell me the three causes of hypertension. Huh? Hypertension occurs because of what? Just before a few seconds, I said, hmm? Bandrelin. Can you hear me, Bandrelin? Bandrelin, can you hear me?
Yes, ma'am.
Can you tell me any three causes of hypertension?
Causes of hypertension. Number
Yeah.
one, stress.
One is
Number
what?
two, stress.
Stress, okay.
Number two, older age.
Mm-hmm.
Number three, genetic.
Genetics, okay. Okay, Jam Nunu, can you hear me? Jam Nunu. Jam Nunu, can you hear me or not? Yes, Jam Nunu, can you hear me?
Yes, ma'am.
Okay, can you continue with the topic, with the causes? Just now, Bandalin, she said stress, then obesity, then what? Genetics and old age, she said. Can you continue?
Yes, ma'am.
Can you continue with the causes? Huh? Yes, Jam.
Ma'am, I don't know.
Just now I discussed, no? It's not even 5 minutes even. Can you see this, Jam Nunu?
Yes, ma'am.
So these are the causes. It might be the person is smoking too much. So for that the person can have hypertension.
Yes, ma'am.
If the person is overweight, okay, obesity, too much weight, fat people, so they
Yes,
can have hypertension. Lack of physical activity means what? Means if the person is not doing anything, just eating, sleeping, doesn't do anything, doesn't work, do anything. So all those people also can have hypertension. Next is eating too much salt. Okay, if you consume too much of salt, you can have hypertension. Next is too much alcohol consumption. Okay, if the person consume too much of alcohol, the person can have hypertension. Next is maybe because of stress. If the person is taking too much stress, he or she can have hypertension. And we see in old age people, okay, elderly people, they all can have hypertension. Next is genetics. Genetics means genetics means what? Means heredity. It means if your forefathers were having family history, you can say. If your forefathers were having maybe grandmother, grandfather, uncle, auntie, means if anyone is having hypertension from your family, then you are also at the risk of having hypertension. Next is chronic kidney disease. If you have, if the person have kidney disorders, then the person can have hypertension. Next is adrenal and thyroid disorders. You remember now in the endocrine system, adrenal and thyroid. So in all those systems, if there are some disorders, the person can have hypertension. Next is sleep apnea. Apnea means disorders, means the person won't be able to sleep properly. Okay, maybe the person will sleep maybe 1 hour like that. Okay, is it clear now, Jam Nunu?
Yes, ma'am.
Okay, tell me any five then.
Now,
Yes, now. Tell me any
but
five.
stress
Hmm.
and then obesity.
What?
Oh no no no. Stress.
Stress, then?
Uh, what was it? Ma'am, I just forgot.
Now only I have showed you. Not even a second. Serious.
High.
Smoking. Okay,
Yes,
means if a
ma'am.
person will smoke too much, then
Yes.
lack of
And
physical activity
weight.
means if the person won't do any physical activities, okay, and no such doing anything, the person can have hypertension. Yeah, hypertension. Then if you consume too much of salt also, and if we consume too much of alcohol also, okay, is it clear now?
Yes, ma'am.
Don't get confused, okay?
Yes, ma'am.
And what are the symptoms? Every one of you can hear me.
Headache,
No, I'm not
shortness of
asking you.
breath.
You can mute yourself.
Oh,
Every one of you, can you hear me? If
yes, ma'am.
yes, if yes, then you can drop a message in chat box. Some are saying Sakani, then Tanu Gurung, then Tau Yati. Can you hear me now? Sakani, Tanu Gurung, Tau Yati.
Yes, ma'am. I can hear now.
Okay. Okay, so what are the symptoms of severe hypertension? Means what will you find in the person if the person is like having hypertension? First is the person will have headache. Okay, means the head will pain. Next is shortness of breath. Means the person won't be able to breathe properly. Next is nose bleeds. Means from the nose, from the person's nose, blood will come out. Okay. Next is dizziness. Dizziness means the head will go round. Dizzy means the person head will go round. It will rotate. Next is chest pain. Okay, the person's chest will pain. Next is visual changes, means the person won't be able to see properly. It might be blur also, blurry vision. Next is blood in the urine. Okay, means blood will be present in the urine. And next, what will happen? The person chest, neck, ears, all this, all this will also pain. Okay, is it clear the symptoms of hypertension?
Yes, ma'am.
Okay. Next is risk factors of hypertension. So, if the person will have hypertension, what are the risk factors? What are the risk factors for it? First is what? Blood pressure tends to raise with age. So, what will happen as the person grows older, the person can have hypertension. Next is race or ethnicity. So, mostly it occurs to African American adults. Okay, this part is not that really much important for you all. Next is weight. So, if the person will gain too much weight, if the person will be obesity, then the person can have hypertension. The person's blood will raise up. Next is gender or else sex. So before the age of 55, men are likely than women to develop high pressure. Okay, and women, that is after 55 years of age, they are mostly likely to develop this hypertension. Next is lifestyle. So, because of lifestyle, also the person can have hypertension. Means they are at the risk of having hypertension. Like what? Like the lifestyle, like as I've already said, not doing anything, lack of physical activity. Okay, and if the person will eat too much of salt, consume too much of salt, sodium. Okay, the person can have hypertension. And if the person drinks too much alcohol, and if the person smokes too much of alcohol, then they can have hypertension. And the next is family history. Family history also have, as I've already said, if the it can inherit. Okay, it's heredity. So how can we prevent from having hypertension? The first one is eating a healthy diet. So if the person consume less amount of salt, okay, less amount of salt, and eat healthy food like what? Plenty of fruits, vegetables, grains, the person can prevent themselves from having hypertension. And if the person exercise daily, okay, then the person can lose weight as well as they can lessen down a little bit of their blood pressure. Next is same thing. Being a healthy weight means the person can maintain the weight by doing all those physical activities. Next is limitation of alcohol. In alcohol, what happens? Too much extra calories are added. Okay, to gain weight. So for that, the person have to avoid alcohol. Is it clear now about hypertension?
Yes, ma'am.
Okay. Now we will discuss about hypotension. So from the name itself, hypotension, it is a medical term. It is a medical term, which means what? Which means when you have low blood pressure, when the person will have low blood pressure, hypotension is mainly used. So hypotension it starts from when? 90 by 60 mm of Hg. Okay, means it
Ma'am,
will be less than that. Huh?
I can see the screen.
Can everyone see or not?
Yes,
Uh, is it
Now, ma'am.
visible?
Yes, ma'am, we can see.
Yes, ma'am. Now I can see.
Okay, okay. So hypotension means what? Hypotension means when you have low blood pressure. So hypotension, it will be less than 90 by 60 mm of Hg. Okay, so means what? Means when you have low blood pressure. So what are the causes of this low blood pressure? It might be because of pregnancy also, and it might be because of hormonal problems also. Hormonal problems like what? Such as means thyroid. Okay, so this thyroid I have already explained to you in your anatomy class, that endocrine system. So if you have disorders in the thyroid, okay, hormonal problems, you can have low blood pressure, and also diabetes. Diabetes also, because of diabetes also, like the person can have hypotension, or it might be because of low blood sugar also, which is known as hypoglycemia. Hypoglycemia is known as low blood pressure. Oh, sorry, low blood sugar. Okay, hypoglycemia means low when the sugar level, okay, means will be low in your blood. At that time, it is known as hypoglycemia. So hypoglycemia is what means because of hypotension, the person can have hypoglycemia also. Okay, means low blood sugar. And if the person is what means thyroid problem, you can say, or else hypothyroidism. Okay, means the person can have hypotension. Next is maybe because of heart failure, the heart is not functioning properly. So at that time, the person can have what? Hypotension. Next is heart arrhythmias. Arrhythmias means what? Abnormal heart rhythms. Means when the heart won't function properly, not in the normal stage, then the person can have hypotension. Okay, next is what? Widening or dilatation of the blood vessels means when there is abnormalities, you can say when there is abnormalities in the blood vessels, maybe when the blood vessel is bigger in size, maybe when the blood vessel is smaller in size. Okay, at that time the person can have hypotension. Means in the blood vessels there is uh, means changes will occur. Okay, at that time the person can have hypertension. Hypotension, sorry. Next is what? Heat exhaustion or heat stroke. You remember my heat exhaustion or heat stroke? I have taught you in this one. Temperature. Remembered or not? Yes, remembered.
Pardon, ma'am?
You remembered or not? I have taught you heat exhaustion and heat stroke.
Yes, ma'am.
Remembered, na? Yeah. So at that time, means if the person is having heat exhaustion or heat stroke, the person can have hypotension. Next is maybe because of liver disease also. It means if there is any abnormalities in the liver, then the person can have hypotension. Okay, is it clear, everyone?
Yes, ma'am.
Yes, ma'am.
Okay. Next is loss of blood from bleeding, means if the person bleeds too much. Okay, means if the person will bleed too much, then the person can also have hypotension. Then low body temperature. Low body temperature also the person can have hypotension, and even this one high body temperature also the person can have hypotension. Then next is heart muscle. Heart muscle disease causing heart failure. So same thing only as I've already discussed. So because of heart disease also means the heart is not functioning properly. So at that time also the person can have hypotension. So next is sepsis. So sepsis is same with loss of blood from bleeding. Okay. So sepsis means what? Sepsis means there is infection. Okay, severe blood infection in any cut, or wound from your body part. So that one is known as sepsis. Next is severe dehydration. Means if the person will have a severe dehydration, maybe in terms of vomiting, diarrhea, fever. So at that case, at that time, the person can have hypotension. Then a reaction to medication or alcohol means if the person consume alcohol, or else if the person will have allergic reaction to the medication, and then at that time also the person can have hypotension. Okay, is it clear till here? Yes.
Ma'am, can you repeat this one, the last one?
Which one?
This one, ma'am, loss of blood from bleeding and low body temperature.
This one.
Yes, ma'am.
Okay. So if the person lose blood too much, okay, like if the person is bleeding too much, then what happens? Loss of blood occurs. So at that time, the person can have hypotension. Next is what? If the person has high blood pressure, high body temperature as well as low body temperature. So in both cases, the person can have hypotension. Next is what? Heart muscle disease causing heart failure, means if the heart is not functioning properly, means if the muscle of the heart, okay, you remember no muscle?
Yes, ma'am.
Which one in your heart? Which part?
Uh,
Which part?
similar,
Cardiac muscle. You remember it or not? Cardiac muscle. My, myocardium or endometrium? Oh, sorry, endocardium. Huh? Which part?
ma'am.
Yes. Which part? Anyone knows?
Myocardium.
Yes. So at that time, what happens? Yeah, when your heart muscle, okay, it will cause failure. Means what? It won't function properly. At that time, the person can have hypotension. Okay, next is sepsis. Sepsis means what? Means if the person is having a blood infection, okay, maybe from the cut or from the scar of the person's body. Okay, means if the person like is not treating the wound at the proper time, at the exact time, then what happens? the person can have blood infection. So it is known as sepsis. So at that time, the person can have hypotension. Next is what? Severe dehydration. If the person loses too much amount of fluid from his or her body, maybe in terms of vomiting, diarrhea. Okay. So at that time, the person can have hypotension. Or else if the person is having fever also, at that time also the person can have hypotension. Next is a reaction to medication or alcohol. Means if the person consume alcohol or else some medicine which is not suiting for the person's body, at the time what happens? The person can have hypotension. So these are the causes. Okay, is it clear everyone? Is it clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, next is what? Fatigue. So same thing only means weakness you can say. Then lightheadedness means if the person head will be very light. Okay, means and again next is dizziness means the person head will go round. Next is clammy skin means like this. It will become sweaty. Okay, it won't be dry. So the person's skin will become clammy. Next is means because of depression. Next is loss of consciousness. Okay, the person will have the person's consciousness will be gone. Okay, means the person will lose his consciousness. Next is what? Blurry vision or vision disturbance means the person will appearance will be like this. Okay, means it will be blurred. It won't be clear. Next is palpitations. Okay, means the person pulse. Remember my pulse. So the pulse will be fast or else irregular. Next is confused. The person will be confused. Then next is the person will feel thirsty. Then next is cold or sweaty skin. The person skin will be cold as well as sweaty. Next is rapid breathing. Means the person will breathe very rapidly. Okay, is it clear? Today I'll discuss till here. In the next class I will continue. Is it clear?
Yes, ma'am.
Okay.